Willow Creek Springs presents Healthy Living with your host, Joe Grumbine.
Well, hello and welcome back to the Healthy Living Podcast. I'm your host, Joe Grumbine, and today we have a very special guest. Her name's Dr. Brigitte Rozenberg, and she's the founder and clinical director of Spinatomy Chiropractic Spine and Disc Centers. And she's got a lot of credentials, one of the most innovative models in non-surgical spinal care. She's got over 30 years of clinical experience, and she's built these centers into multi-location practice. And you know what? Instead of focusing on a lot of details, Bridget, welcome to the show. I'm really grateful that you're here and glad to have you.
Thank you for having me. I'm very excited to be on your show, share all the knowledge, share the options. In my career, after so many years of practicing, you get to the point where it's like, okay, so what's next, and what do you do, and why do you do what you do? And I feel like the more people know about it, the better they'll be, and the
Absolutely. Well,
message.
I'm kind of excited to hear about your story. There are so many reasons people get into the healthcare field, and chiropractic has been around for a long, long time. And what brought you to it?
My mother was a physician, so
Okay.
I always was drawn to becoming a doctor. That was my passion. I really, really enjoyed that. And someone told me, a mentor once told me that you don't choose the career chooses you. I stumbled upon chiropractic. I really enjoyed the philosophy. I really liked the patient interaction. I had chiropractic care myself. I felt like that would be a perfect fit for me because I wanted to be a mom and start a family, and I knew that just going through the regular medical, school would require me to really spend a lot of hours in the ER and in the hospital, and I
All
really
right.
said, like, you know what, that sounds like something. First of all, I love the treatment. I feel like it's very beneficial, and I can really interact with the patient. I don't know, it drew me. I was very much drawn to that. And like I said, I guess it chose me because I feel like after all these years of practicing, now I have a bigger message and a bigger mission and a purpose. So,
Love it. So, just for our listeners, I don't like to assume everybody knows everything, and I like to sort of break down. Chiropractic is got a lot of information. There's a lot of bad information out there and good information. So you hear a lot of uh, a lot of people's experiences about chiropractic. Why don't you just explain what that actually is?
so chiropractic is it's a it's a medical, it falls under the medical realm, right? But it's a healing science that basically concentrates on treating the patient with, with a focus on musculoskeletal system, the spine, the nerves, the discs, the extremities, and all of that. But just like in anything, under any healthcare realm, you can do many different things. There are chiropractors that are very just regular family practice. They treat the kids and adults, and they treat all these different, age group. And then you have those chiropractors that are very specific to sports injuries, and you have those chiropractors that are very specific to just car accidents and work related and trauma related injuries. You have others that are very focused on nutrition. So, our body, now more than before, there is a lot more awareness of health, wellness, longevity, all these different things that we can do. The world is changing, and
Right.
chiropractic, if you take it for what it is, it actually works on the muscular skeletal system. So, even though I've done it for so many years and throughout my career, I've seen it all, and I've
Right.
been around doctors say, "Oh, you guys are not the real doctors," and I've been around that said, "Oh my God, I love chiropractic. It changed my life." It's about education,
Sure.
about knowledge. I always told patients when they started to talk to me about in those manners. I said, look, you don't go to the dermatologist when you have a heart problem. When you
Right.
have a heart problem, you go to the cardiologist.
For
When
sure.
you have a bone issue, a broken bone, or you need some surgery because you had a ski accident, you go to the orthopedic surgeon. You don't go to the cardiologist for a bone. You know what I'm saying? So
Sure.
you need to understand, and I explain that to the patients, that you need to know who you need to go for which problem, for what problem. You can't go to one person that's going to save everything. So if
Right.
you have headaches, neck pain, back pain, unresolved, different musculoskeletal conditions, and you don't get better with the medication, because back then, it wasn't like it is now, again,
Right.
a lot more awareness. You don't get better with injections, then maybe you should try something else.
Right.
And, and
Common sense goes a long way, right?
well, as we know, common sense is sometimes not very common.
Not at all.
But what I like is I'm very straightforward and I'm commonsensical in my explanation. I said,
Mhm.
I don't fix everything. I fix very specific conditions that are related to my work and my specialty. So if you have headaches, if you have back pain, if you've been involved in injuries and nothing else worked for you, chiropractic can really save your life. But if you have diabetes and you have this and you have that, I personally don't have, I'm not, that's not my area of expertise, even though there are chiropractors that they do, specialize in functional medicine and things like that. I said, but I can't fix this. But if you have, back pain, I can fix this. And if
You're
you,
not going to pull out an impacted wisdom tooth.
no. It's like, and so over the years, as any other field of medicine, things evolve, things become better, things become a lot more knowledge. I mean, the general public became a lot more knowledgeable. I feel that there was a huge shift and a huge complete 180. Everything in healthcare changed tremendously for the general public after COVID.
Right.
The general public, I'm not talking about those health freaks or the ones that are into biohacking, which I'm not. I'm not opposed, or I think all of it is incredible and it has so much space. But let's assume the average patient doesn't know what it means. It doesn't know what it is,
Right.
doesn't know what it's doing for him.
Just trying to live a life.
Exactly. I believe that every patient or every person that either had COVID, was exposed to someone that had COVID, lived in the world we all lived in during the pandemic, uh, experienced something with this that they didn't experience before. So
Sure.
whether the symptoms after this condition, after this virus affected them long term, whether the symptoms of the vaccination affected them long term, whichever part of that journey they
Somehow you were touched.
sorry,
I said, somehow you were touched.
somewhere exactly. And if you were touched by anything and whatever that is, you have a different view of the outcome of this virus or this situation that occurred in the world. And
Sure.
you are developing maybe an opinion that before that you didn't have because you trusted one system. And
Right.
I have a lot of patients that had COVID, and I had a lot of patients that had the vaccine. And I am not here to advocate against or pro. That's not the platform for
Oh,
that. But
that's not what
I'm
this
just
is about.
I'm just going to share with you the information that I experience, that I have so many people that specifically in my space, because they have pain, they developed so much inflammation, so
Mm,
many symptoms that they've never had before, that
right.
whether they can connect it or somehow, think that it's related in one way or another, what I'm trying to say is that this time in our history and life changed everything or changed a lot of the way we view healthcare and what are the options that are available for us. And I think that the general public is understanding that, okay, there are more options for me, and I'm not just going to go with what they tell me. How about I do a little bit more research and find out what else can I do or what else is available for me to fix and treat X, Y, and Z conditions.
I
And
think that's fantastic. I'm always telling our listeners to step up and be your own advocate because there are so many answers. People get stuck into the healthcare system and they go to their primary doctor and they tell them what to do and they just sort of follow along, maybe not realizing that for every solution that's presented to them, maybe there's two others that wasn't. And it's up to each individual to do some research and see what's out there and figure out which route you want to go on. Now, as you were developing your practice initially, this is obviously a long time before COVID. Did you have a specific focus, or did you just open your doors as to the general public?
My specific focus, because I'm coming from a medical background, was always treating injury. So
Okay,
my focus was always trauma-related injuries. So whether it's slip and falls, car accident, work-related injury, sports, a little bit of everything as it relate to injury versus just regular wellness. This was my focus. I always was intrigued about how do I solve the problem and get the patient back to their normal life. And, of course, over the 30 years, there's so many developments, so many new technologies, so many new things out there that are available to patients. And kind of that's the route I took 30 years ago throughout my career. And of course, now with spinatomy, that's the route I'm taking currently.
I love it. So, do you deal mostly with acute treatment or more like rehab, sort of post care treatment?
So the very unique thing that I do here in Spinatomy, and I created and developed Spinatomy about 6 years ago. I specialize in treating patients with advanced disc condition like herniated bulging disc, sciatica, pinched nerve, degenerative disc disease, all these different spinal conditions that are very debilitating, disabling, require invasive procedures, surgeries, injections, drugs, all of that. And so
Right.
I came up and created a treatment plan. I did not invent the technologies, but I really created and invented a protocol and trademarked a protocol called Advanced Spinal Restoration Treatment that allows patients to get better and to heal themselves from all these debilitating, painful conditions without invasive procedures, using technology in a very systemized pattern, very specific formulated plan, specific cadence, and the results are amazing. And so that's my message, and my purpose is to really educate as many people as possible of the opportunities and of the choices that are available for them. So when they make a decision, they make an educated decision.
Well, that's exciting. As I get older in life, you run into more and more people that have more and more problems with their backs. And my experience has been it's about 50-50 for the people that have had these invasive procedures, whether it's surgeries or whatever, the injections, all different things they do for disc problems, and whether it's a bulging disc or a herniated disc there's so many problems that can happen with these discs. And to hear that there's, some viable solutions that don't require, there's people that get crippled after a surgery and then they get another surgery and another surgery, and it turns into this, painful nightmare that never seems to get better. And then they get into drugs because of the pain and they end up in a, fairly miserable life that wasn't better than when they started.
You nailed it. This is exactly the sequence of events that I see and hear every day in my practice. They start with one little non-invasive or minimally invasive surgery that works for a little bit of time, and then 1 or 2 years later, or 5 or 6 months, depending on their own situation and condition, they need a second surgery. And it's also minimally invasive. And then they have pain from that. And then they need to have multiple epidurals. And then they're looking into surgery number 3. And it's like this never ending vicious cycle of all these different things. And meanwhile, they're in so much pain. And they're like, I wish I would never even do it to begin with.
Right.
And, there are times that surgery is necessary and it will save your life. But there are a lot. I just spoke to a patient before I jumped on this podcast who told me that he has back problem. He had a minimally invasive discectomy in his neck, and he had 4 epidurals in his low back, and he really does not want to have another surgery on the low back. And he said, it's interestingly enough that now that I'm starting to research, and then I came across some orthopedic and neurosurgeon that are telling, and they're talking about online that don't do surgery unless you really have to, because the results are not always favorable. It's a very 50-50 chance, and you can develop a condition called failed back surgery syndrome.
Wow.
So there are a lot of awareness out there now in regards to what works, what doesn't work, and how to fix it. And you know, there are solutions for patients with debilitating conditions that they can get better without going under the knife, for sure.
Hi, this is Joe Grumbine, and I wanted to share an update. The platform that hosts this podcast has made some changes to the subscriber settings, and we have a number of subscriber-only episodes that we offer to the supporters, and for a minimum of $3 a month, we can get you signed up. And if you're already signed up and you're having some kind of trouble locating these episodes in the other platforms, I would say maybe the best answer is to unsubscribe and then resubscribe. I'm sorry for the hassle. I don't have any way to make a change, but I'm very grateful for all the support. Thank you. I love it. So I know a little bit about chiropractic. I've been to a chiropractor's a few times in my life, and it seems that it's a pretty wide-ranging spectrum of treatments that chiropractors offer, and it ranges from simple adjustments and some fairly, I don't know, I would say primitive sort of tools, all the way to, like you were saying, real high tech. And I have no idea even where the technology has come to this day. It's probably been 15 years since I've been to a chiropractor. But why don't you tell us a little bit about some of your tools of the trade?
Yeah, I use a lot of technology in my practice, and I'll mention some of them. The main thing that I do in my advanced spinal restoration, I mean, adjustments is always part of everything, but you cannot fix everything with adjustments. And
Right.
there are some patients that it's not even the right thing for them because it's not even going to work on them. So one of the biggest thing that I do is I use the most advanced non-surgical spinal decompression system, which is it's the most advanced in the world, and actually it's made here in the United States. It's all FDA cleared to treat a disc and a herniated disc and a pinched nerve. And basically, it's a computer generated technology that allows, when I place a patient on that particular table, it's a table with a computer attached to it and a tower, and it basically stretches and decompresses that disk that I program into the computer based on their MRI. So I have to have an MRI to diagnose the patient properly. I don't just in my practices, and I have 3 locations, I don't just stick someone on a table. That's not the way to do it. You got to really understand what the problem is and understand, how to treat it. So I put them on a decompression table, and it takes the pressure off the nerve. And when you relieve the pressure off the nerve from a herniated disc, the patient feels much better and have great relief. Now, on top of that, when you have a pinched nerve, you develop a lot of inflammation and pain. So then we use additional, tools such as laser therapy. We use electroanalgesia, which is a pain management device. It's not like a TENS unit. It's all extremely high tech. It blocks basically the pain signals from reaching the brain, and it
Wow.
stimulates tissue recovery on a cellular level. We use softwave therapy, which is a stem cell stimulation. We use a lot of, we use a new device that just recently been FDA cleared. Again, I'm using those terms because these are not just machines that
Right.
someone developed in their garage and he
Right.
have it in the office. These are very high tech modalities that have very specific clearances by the FDA to be treated for a specific thing. We use a machine called M-Scope Neo, which actually helps patients with muscle atrophy and weakness. It builds muscle tone. So the treatment that I created and designed follows very specific 3 protocols. We call it repair, restore, and rebuild. So first of all, we need to repair the problem. Then we need to restore back the function, make sure that your body can, function. And then we need to rebuild you back so you can go back to a normal lifestyle. And the concept is that our body has the ability to heal itself if we provide it and give it a right environment.
Agreed.
To do that, you really need to give it the right environment. And these modalities are, every single one of them is providing a different portion of this environment in order to reach the full healing effect. And
I
that's how
love
you can get rid of this pain without surgery.
Wow, that's impressive. So, I mean, it sounds to me like you're a pioneer in the field. You know, I'm not knee deep into the field, so I'm not, up on the latest who's all doing what, but I haven't heard of this sort of approach. And I deal with a lot of people, a lot of different modalities, a lot of different practitioners that come through this podcast, and even just in my community that I'm working with. I'm hearing some things I haven't heard before. So do you consider yourself a pioneer in the field?
I am a pioneer in the field. I really feel that sometimes it's a good thing, and it's sometimes a difficult thing, because it's a good thing to be the pioneer and trailblazing something, but it's a little bit more challenging sometimes because people just don't understand and know, and they think that, oh, let me ask my doctor what he thinks about that. And oftentimes the doctors doesn't even know.
Exactly.
Or
That's
they,
what I was
because
getting
they
to.
know what they know, and they don't know anything more than that.
I couldn't agree more. I think that's sort of the, I'm on the finishing edge of defeating a really aggressive cancer, and I've had to become a pioneer in my own field of solving my problem because oncology's, 20 years behind the available treatments, and I've had to navigate through a lot of alternative things. And most of the time I bring a potential solution to a doctor and they say, I don't know anything about that. And they don't necessarily have a negative opinion about it. They just don't know. And it's not part of their standard of care they've been trained to work with. And I've been working with a number of pioneers, a lot of doctors that are willing to kind of push the limits. And you know, science gets advanced by these types of people and people willing to, push the ticket a little bit and all of that. But a lot of times there's pushback and, the industry sometimes doesn't like the change or isn't sure of it or, the old guard doesn't necessarily like the new kid coming up going, oh, maybe we're going to do this thing. Do you have any sort of experience where you've gotten pushed back on it all?
I had a lot, of course, we all do when we use things that are outside of the mainstream and kind of like thinking outside of the box.
Mm-hmm.
In big platforms and small platforms, we see it all the time.
Right.
But, yes, of course. Well, I mean, I had exactly the same as you described, that patient that went to their doctor and the doctor said, well, I don't know anything about that. I would not go on this machine. I don't know much about this. Well, I'm like,
Right.
well, but I would do an epidural or I would do this. And I'm like, then I say to the patient, I'm like, well, what I'm explaining to you, I'm not convincing anybody to do anything, because at the end of
Right.
the day, it's your choice and you're going to make your own decisions.
100%.
I am showing you and I am explaining to you what can be done if you do it that way versus this way. And if you still need to do surgery, you can always do that. But
Right.
no U-turn from surgery, right? Because I said, and I always say that surgeons are very well trained and they know what they're doing, and they're there to save your life um, all the time. I'm going to say that. I'm not going to say most of them, but all the time.
Yeah, yeah, that's their
But
job.
exactly. But you are dealing with a very sensitive anatomy.
Right.
Spinal cord, the spine and the bones and the discs and the nerves. It's a very sensitive anatomy. You do not know how your body will react to the successful surgery.
Right.
You just don't know. So you can always do it But why don't you want to try something that's less invasive if it makes sense to you? My job is to educate you and to make sense out of it. Your job is to say, you know what, that makes sense. I want to try this, or that does not, and I'm not going to try it. And it's like in everything else you do, the food you eat, the way you live your lifestyle, it all falls under the same kind of umbrella. It has to make sense.
Well, I think you're bringing up a really important point. I think as a patient and a patient advocate is looking at a treatment, when you go to the healthcare system, often their first solution is a very aggressive, potentially invasive, and potentially negative outcome. They put the risk into the factor of it all. And as a human being who's trying to make sure that I get the best I can, it makes sense to approach it in an incremental way. You say, well, what's the least dangerous thing I could do that might help me? And I look at, the safety versus possible outcome, and I start with the most safe, and maybe there's not the highest possible outcome, but it's the most safe. So, if it doesn't work, well, you can always go to a little less safe thing. And it doesn't seem that the healthcare system has that sort of approach, whereas some of the more holistic modalities seem to bring that, again, common sense into it. Let's start with the least harmful thing and work our way out, to a more risky thing if you need to. And I really like that about, your approach and some of these. I know we're getting a little light on time, but I really like to hear a couple of questions. Number one, your practice is growing, and obviously this is a lot of modalities. They do this, virtual work and all this, but this is a hands-on situation that you're dealing with. So tell us about where the areas that you do serve.
So I am in the Los Angeles area. I
Okay.
have three locations. I have one in the Van Nuys area, which is the San Fernando Valley, one in Culver City, which is near the beach, near Venice Beach, near Marina del Rey.
All right.
And then I have one in Ontario, which is more the Inland Empire. So those are my three locations, and we have all the centers are equipped with the same technology in all of them, and we serve the population the same. It's the same treatment plan. All the doctors are trained. I travel between the locations. We have a whole team of nationally trained staff that, again, this is not someone that can turn on and off a machine. Uh,
Right.
I was just very specific. So that's where I am. The name of the practice is called Spinatomy Centers. And you can find us on spinatomycenters.com. We have a website with a lot of information. We have a lot of information on many different platforms, videos on YouTube, Facebook, all that stuff. So you can see how it's working and how it's done. And yeah, that's I have a mission and I have a purpose, like in this stage of my career, like to really give people another choice and another hope. And if I can, I can't change the world, but if I can give people another option to have a better life, then I feel like I've done my share of helping.
I love it. Well, this has really been an eye-opening conversation. Actually, your Ontario practice is only less than an hour from me. I'm out here in the Inland Empire myself, so I will definitely let people know about you. This has been fascinating, Bridget. I'm very pleased to have really gotten a chance to look through your eyes, and I really I see you seem really inspired, and I really look forward actually to hearing about the future of this. Where do you see yourself in 5 years? How do you see this to expand and grow?
That's a great question. But honestly, I would love to um, take spinatomy nationwide and internationally. I think that this is there are such a big need in the market and the population for patient. Back pain is the number one cause of people missing time off work. It's the number one cause of disability in the United States, and it's a multi-billion-dollar industry. But it's because people just don't know what the other options are. So I would love to be everywhere and help other physicians and other doctors implement the same system that I have. I can't open offices everywhere. It's a lot. I'm just one person, but I am on a mission to really help a lot of other doctors that want to implement the same disciplines and the same practices in their facilities and grow this nationwide. That's where I see myself.
Do you attend conferences and symposiums as a presenter?
I do, but I need to attend more now. So if you have anything suggest, then I'll be open for suggestions. Yes, I do, of course.
I love it. I love it. Well, hopefully, we'll be able to continue this conversation. We have so many things we could still talk about. It's really been an honor to spend some time with you, Dr. Brigitte Rozenberg. I really want to thank you for joining us on the show today.
Thanks, Joe, for having me.
Well, this has been another episode of the Healthy Living Podcast. I'm your host, Joe Grumby. I want to thank all the listeners who've made this possible, and we will see you next week. This has been another episode of the Healthy Living Podcast. We produce this show so that people can share their stories, people that have overcome obstacles, people that are undergoing obstacles. We're building a community of health-minded individuals. If you're interested in supporting the show, please leave a review on the platform you're listening to it on. If you're interested in becoming a guest, please send an email to itsjoegrumbine@gmail.com, or you can send a note into the notes section of the podcast. All right. Well, thank you for supporting this show, and we hope you've enjoyed it.